Hi, my name is Amy Hoing. I'm a physical therapist here at the Institute for Orthopedic Surgery, and I'm going to show you some of the exercises that we do after having a total knee replacement. I would really highly recommend that you practice these exercises prior to having your surgery, no matter how many days you have before having to come back, because it has been proven time and time again that the stronger you are coming back in and the more range of motion you have coming in, the better your recovery is. So I really highly recommend that you practice these before coming back. First exercise is what we call a quad set. The quad is the top thigh muscle. It is done by tightening the muscle on the top of your leg by trying to force your knee down. You'll see the muscle, the kneecap, try to come up. You hold the contraction about 5-10 seconds and then relax, and then repeat, and then relax. Good. The next exercise is going to be the glute set. That is going to be squeezing your buttocks together, holding it once again for 5 to 10 seconds, and then relaxing. And you're going to do both of these exercises for approximately 10 repetitions. The next exercise is called an ankle pump. You do this with both sides, and this is to help prevent blood clots. We want to make sure that you're keeping the blood flowing through the lower leg so that it doesn't sit still and clot. So this is your way of helping prevent those blood clots. Those three first exercises are going to be asked to be done every hour once you're in the hospital after your surgery. The next exercise is called a heel slide. You're going to slide your heel up towards your buttock, trying to bend the knee as far as you can. You're going to hold at the end for at least 10 seconds. Then you're going to let it back down. Now remember, when you get to the end, you may feel a little bit of pain, okay? What's happening is you are stretching the muscle, and the muscle has been cut through and it's not very happy. But remember, you are not injuring anything by doing this, okay? The muscles are letting you know that they're being stretched, but there is no injury happening to the device. Hold and then back down. Very good. The next exercise is a straight leg raise. You're going to bend the opposite knee up. You're going to tighten the muscle on the top of the leg, the quadricep again, and you're going to try to lift your leg up to the height of the opposite leg. Hold it a second and then back down. Do not be alarmed if you cannot do this exercise. The muscle is very, very weak, and some people right after surgery are not able to lift their leg. The next exercise in the picture shows a ball that we put underneath the knee. You don't necessarily have to have a ball. You can roll up a blanket, towel. What we want is the knee to be bent at about a 45-degree angle. And the instruction is going to be to lift the heel up and try to straighten the knee as far as you can. Hold it and then lower it back down. You're tightening the top thigh muscle once again. Very good. The next exercise is a hip abduction and adduction. I'd call it a windshield wiper. You're going to have the toes up and you're going to slide your leg out towards the side and then back in. Good. You can let it slide on the table if you'd like, or if you're able to lift your leg up, you can slide it with lifting. Very good. The next exercise is a heel prop. You're going to want to roll up a towel like you see here, and you're going to place it underneath the heel. And then just try to relax in this position and let your leg go down as straight as possible. You want to hold this for hopefully up to about 2 minutes if you can tolerate it. And you're going to feel a pull all along the back of your leg, along your hamstring and your calf muscle. This is the one that probably the most people complain about because the hamstring and calf are usually in a shortened position in an arthritic knee. But we need you to do this as often as you can in order to help prevent muscle spasms. A lot of people complain of muscle spasms after the surgery, and they tend to want to put their knee in a comfort position by putting pillows under the knee or putting their knee in an externally rotated position for comfort. But that causes the muscles in the back of the leg to shorten and therefore spasm a little bit more, and it causes a cyclical muscle spasm cycle. So we want you to try to be in this position frequently to stretch out these muscles and hopefully help you be more comfortable in the long run. The next exercise is called a long arc quad. You will be in a sitting position, and you are going to contract the top thigh muscle by kicking your leg out straight, and then you're going to contract the hamstring muscle and bend the knee. You're going to hold the contraction for at least a second at each end range. So contract and contract. Good. You will be getting up for all of your meals. That means you will be sitting up into a chair or sitting at the edge of your bed. This is a perfect opportunity to either dangle your leg or sit as normal as possible with your knee bent. This will help try to gain range of motion by just being in a bent position and allowing the stretch for the flexion range of motion. You will need a walker for after your surgery. We prefer that you have one with standard legs. If you do have one that only have wheels, you can bring it with you, and we will let you know when you are able to transfer to that safely. To make sure the one that you have is going to fit you, you have to stand in the walker with your arms down to your side, and the handles have to come to your wrist bones. If it does not, then you just have to go down to the end and bring the legs up or down. This one fits him perfectly. You will be weight bearing as tolerated after your surgery. What this means is you can put as much weight as your pain allows on your surgical leg. In order to walk, you will use this sequence. You want to place the walker out in front of you by just straightening your elbows and placing the walker down, all 4 legs down at the same time. You're then going to take a step with your surgical leg first, put the weight through your hands, and then take a step with your non-surgical leg. Place the walker, surgical, non-surgical. Each time you take a step, you're going to gauge how much weight goes through that leg. While you're here at the Institute for Orthopedic Surgery, one of the jobs of the physical therapist is to test whether you are safe to go up and down stairs. Before you come to have your surgery, please evaluate your home and how to get in and out and how many steps you have and whether there is a railing. And please tell your therapist what that is so that we can determine whether it is safe for you to go home. Most people stay here at the overnight care unit for about 2 to 3 days. What